everyone, I'm Dr. Diana Lerner, and I have two volunteers with me today, Zeb Lerner and Abby Lerner, who are going to help us figure out how to properly wash our hands. Ready? Follow us. The first thing you're going to need to wash your hands is to find a sink that has soap and water. It may be helpful to roll up your sleeves so you can get your hands nice and wet. Zab, do you want to start? Show us how you get your hands nice and wet. Perfect. The next step is to get a good amount of soap. And really start to rub your hands. We're going to rub, 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 rub. Once you get a good amount of soap and soapy leather on your hands and palms, you're going to turn your hands on top of each other and rub in between your fingers and on the top of the palms. Okay? Then you're going to switch your hands and do the same on the other side. You want to make sure you're covering, and the action of rubbing is actually what kills a lot of the germs. The next thing we're going to do is flip the tips of our fingers inside the palm and really rub them in. And then switch and do the same thing. Which finger have we not washed really well yet, guys?
The thumb.
All right, let's grab that thumb. Grab and rub, rub, rub. Flip over to the other side, and we're gonna do that also, okay? Now you wanna make sure that you got your tips of your fingers really, really, really well, because sometimes germs like to hide underneath the nails, okay? Very good. And then you get your wrist. Now this whole process should take you a minimum of 20 seconds, and some recommendations even say a minute. So the rubbing is going to be the most important. Now once you did all these steps, what do you do next?
You wash your hands.
Let's do it. Let's wash off the soap. Take your time getting all the soap off your hands. And then you either want to find a disposable towel or a regular towel is fine as long as you know it's clean, and wipe your hands. If you're in a public place, you may want to grab a disposable towel to shut off your water. And then make sure to throw that out. Now, if you don't have access to water and soap, you can use an alcohol-based sanitizer as long as the alcohol content is at least 60%. Now, the most important thing is to wash your hands before you eat and after you use the bathroom. Everybody keep safe, and thanks for logging in.
Bye.
Hi guys, Dr. Diana Lerner again. Thanks for watching earlier about how to properly wash your hands. And right now, I'd like to take you through a very resourceful place you can read way more about coronavirus and other protective information about how to keep yourself and your loved ones safe. I want to thank the Friendship Circle for the opportunity to talk to you about this today. So let's see what the CDC has to say. If you go to the cdc.gov website, which is the Center for Disease Control and Prevention, you will land between two options, either how to protect yourself or if you think you're sick. Let's start with how to protect yourself. Now, what we know about coronavirus, number one, it's a brand new kind of virus that infects humans. Our bodies have not learned how to protect this virus yet, and unfortunately, there's no vaccine or treatment available as of right now, even though many places are working on that to help us out. Until then, the best way you can protect yourself is to stay away from other people who may have the virus, which is why you may have been asked to stay home, or your kids have been sent home from school or college, and your work may have asked you to work from home as well. If you are needing to go out in the community, please stay at least 6 feet away from other people, as people may not know they have the virus for up to 14 days before getting ill, but they are still contagious. The best way you can learn to protect yourself is by washing hands. The way people get infected is somebody may sneeze or cough onto their hands and then touch a surface you may then later touch. And then if you bring your hands to your mouth, nose, or eyes, you may transfer those viral particles or viral droplets into your body, and then the virus can kind of take hold. So again, if you're out in the community, wash your hands really frequently, and then try not to touch commonly touched surfaces, and then touch your mouth, nose, or eyes. If you are ill, then please stay home, because we want to limit the spread of the virus to other people. If you do have to go out, then we do recommend, if you're ill, to put on a mask such as this. This precludes you from depositing cough or sneezing particles out. You put the mask on as such. These are one-time use masks. They are worn this way. If you're having a very difficult time wearing a mask and you can't breathe easily with that, you don't have to wear it. But then we do recommend that you don't go out in the community. Once you take the mask off, try not to touch the inside of the mask because that's where the viral particles are. You want to dispose of it properly. If you don't have a mask like this and you're out in the community and you need to sneeze, use your elbow. Again, that prevents spread of viral particles, and it's better than sneezing into your hand. You may also do that into a tissue if you're able to then dispose of it properly. Let's go now to the second part of the website, if you think you're sick. The most important thing to do if you think you're sick is just please stay home. You may isolate yourself to a room in the house away from your family, use a different restroom if at all possible, and then do supportive cares. Drink plenty of fluids, get plenty of rest, and call your doctor to notify them of your symptoms. The most common symptoms of coronavirus are cough and fever, sometimes body aches, and some younger children may get gastrointestinal symptoms. Your doctor should be able to navigate you to the proper steps of what to do if you're not doing well or you think you're getting worse. If you need to see your doctor, please go ahead and call to your doctor's office to let them know that you're coming. They may ask you to do a test on the out somewhere else or wear a mask on the way out so that they're prepared that you're coming in. Now, the most important thing to remember is if you're a person who has a lot of medical problems, including heart or lung disease, you may be at higher risk for getting sick from coronavirus. Although majority of people who get this virus recover, such as they would with a common cold, people with major medical problems or problems of the lungs may get quite ill. If you're one of these people, please consider staying home until we have more information about the viral spread and or vaccine or medications available, and follow the CDC and WHO recommendations for what to do next. Consider getting your food and groceries delivered to your house instead of going out to get them and dropped off in your front door. And please, we know this is very difficult, so keep in close contact with family and friends if you're not able to visit with them through virtual discussions and phone calls. It's totally safe to go outside for walks by yourself or just with your family. But again, avoid restaurants and stores if you can, and definitely gatherings of 10 people or more. Thank you for joining us for this discussion about coronavirus and the French Exerful edition. And we want everyone to stay safe and healthy. And please visit the Center for Disease Control website for more information. Bye.